The aorta was first classified and officially recognized as an independent organ on February 26, 2024. It was recognized with the publication of guidelines from the European Association for Cardiothoracic Surgery and the U.S. Society of Thoracic Surgeons. This recognition followed years of research and the growing understanding of the aorta's complex functions and guidelines. The guidelines were developed by international experts under the leadership of Professor Dr. Morten Surtsey from the Medical Center and University of Freiburg. The distinct classification was created to specifically distinguish a branch of medicine targeted towards aortic functions. The recognition is impactful because the aorta is an individual service of specific functions that directly affect all other large organs in the thoracic region. Recognizing the aorta as an organ puts it on par with the heart, lungs, and/or brain. This is a big step for aortic diseases, which have usually been treated either in cardiac surgery or in vascular surgery, depending on their type and location. Recognizing the aorta alongside these main thoracic functions is important because it highlights its critical role in the human body and necessitates specialized care. This recognition underscores the aorta's distinct physiological functions, which go beyond simply transporting blood, including regulating blood pressure, blood flow, and producing hormones. It also emphasizes the need for dedicated medical subspecialties and improved clinical outcomes for aortic diseases. The aorta is classified as a distinct organ because of its tube for blood transport, its crucial role in regulating blood pressure, blood flow, blood velocity, and hormone production. And according to recent research, these findings are published by the European Association for Cardiothoracic Surgery, and it has the new summit status of independent organ. The aorta is a cane-shaped artery. It starts in the lower left chamber of your ventricle. From there, it extends up toward your head a short distance before curving down. The aorta passes through your chest and abdominal cavities and ends at your pelvis. Pairs of smaller blood vessels branch off from various points of the aorta. These branches extend from the reach of aorta to muscles, nerves, and organs throughout your body. The aorta is the largest blood vessel in your body. It's more than 1 foot long and 1 inch in diameter and at its widest point. As the aorta makes its way towards your pelvis, its diameter narrows to 2 centimeters. The aorta is a complex structure that has 3 layers of tissue. These layers include the inner layer, the middle layer, and the outer layer. The inner layer contains a tube through which blood passes. It contains smooth muscle tissue, connective tissue, and endothelial cells. These special cells enable blood to transport oxygen and nutrients without getting absorbed until it reaches the right spot. The middle layer, also known as tunica media, is made of smooth muscle tissue, elastin, and collagen proteins. These substances enable the aorta to meet your body's changing blood flow needs. When more blood flow is necessary, the aorta widens. If less blood is needed, it narrows. The outer layer, the tunica adventitia, is the outer layer anchors and it keeps the aorta in place. It also connects to nearby nerves and tissue. The aorta is the primary source of oxygen and essential nutrients for many organs. If disease or injury affects blood flow through the vessel, life-threatening complications can occur in minutes. The main sections of the aorta include the aortic root, the aortic valve, the aortic arch, and the descending aorta. The aortic root is a section that attaches to the heart. This is the widest part of the aorta. The valve is 3 flaps of tissues called leaflets that snap open and shut due to release oxygen-rich blood from the heart. The ascending aorta is an upward curve that occurs shortly after the aorta leaves the heart. The arch is a curved segment that gives the aorta its cane-like shape. It bridges the ascending and descending aorta. And the descending aorta is a long straight segment that runs from your chest to your abdominal area, the abdominal aorta. Diseases that affect and injuries can affect the aorta's ability to do its job. These conditions include aortic valve disease, aneurysms, dissections, ruptures, and heart defects present at birth. Some of the more common issues affecting the aorta include abdominal aortic aneurysms, dilated aortic root, thoracic aortic aneurysms, penetrating aortic ulcers, aortic dissection, and a ruptured aorta. An abdominal aortic aneurysm is a weak, bulging spot in the aorta that occurs as it passes through the abdominal region. A dilated root is an abdominal widening of the root of the aorta, and a thoracic aneurysm is a bulge in the aorta that occurs as it passes through the chest. An ulcer is a fatty buildup or a plaque that breaks down the tissue of the aorta's inner layer to reach the middle layer. And an aortic dissection is a tear in the inner lining of the aorta. This causes blood to seep into the space between the middle and inner layers. And a rupture is a tear that extends through all layers of aortic wall tissue. This causes oxygen-rich blood to spill out into the body. My sources are the Cardiothoracic Surgery Summit of 2024 and the Cleveland Clinic Health Organization.